There is a global shortage of the oncology workforce, which has resulted in significant cancer health disparities. Reports show that demand for oncology services is expected to rise rapidly by 48% in the year 2030. In Nigeria alone, with a population of over 200 million people, there are less than 100 clinical oncologists. The ratio of a clinical oncologist to a new cancer patient in Nigeria is 1 to 1,645. When compared to countries like the US and Canada, with a ratio of 1 to 137 and 1 to 352, respectively. It is even worse for countries like Malawi, Burundi, and the Central African Republic, where there are no clinical oncologists. Due to this paucity of oncologists, many of our cancer patients will experience suboptimal cancer care. Every year, 116,000 Nigerians are diagnosed with cancer, and more than 70% of them will present late. It is this late presentation that contributes to the appalling cancer death rate, which stands at 63%. We have also found that cancer patients and even their caregivers have sensitive topics surrounding cancer diagnosis and care, and they prefer discussing this with their survivor. Many were misinformed and lacked access to the right patient education. Some just could not find their cancer doctors and clinics quickly. Others would underreport their symptoms and treatment side effects, and a good majority of them do not belong to a supportive community where they could access counseling and survivorship services. Research has also shown us that we can reverse these abysmal statistics and resolve these pain points for cancer patients through early diagnosis and effective treatment. Oncopadi was built to help cancer patients present early, remove the fear from the cancer equation, and put the right tools in their hands to support them. Now, cancer is a public health crisis, and many cancer patients are screaming in pain. They are praying for dignity and a healthcare system that supports them in the toughest battles of their lives. This is why Oncopadi exists, having built a companion app that responds to the needs of patients and caregivers. Oncopadi is a digital health innovation company that is empowering confident cancer care decisions for patients, caregivers, clinicians, and healthcare companies. Oncopadi is a market leader that has created and continues to support the development of healthcare innovation that improves population health and lowers barriers in the cancer ecosystem. The Oncopadi app is solving an everyday challenge with in-app features such as the telemedicine, the e-commerce health shop, digital patient navigator, clinician-connected care, online community, support groups, symptom tracking, cancer coaching programs, e-cancer library. Some of our other innovative portfolio products and programs include the OncoScreen tool. This tool promotes cancer prevention amongst the healthy population, and it suggests the appropriate cancer screening for you. The Oncopadi Hub, which is available in 3 medical institutions. These hubs are digital health hubs that are purposefully renovated space for hybrid working, innovating, connecting, discovering, supporting, collaborating, building, scaling, and growing. Now, whether you're a medical student, academia, or researcher, Oncopadi sets up digital health hubs and mobile cancer clinics to accelerate digital health research. And we do this in 3 ways. 1, we accelerate mobile health research and innovation. We build and scale up medical entrepreneurship, and we connect a community of healthcare innovators. Oncopadi Act, which is our 3rd innovative solution, is a tool that is accelerating access to remote cancer care in underserved communities. In a clinical setting, this tool is a public health intervention program that is designed to improve cancer patients' population. The Oncopadi Act platform consists of the Oncopadi Hub and a purposely built virtual tumor board, which is a web app for cancer specialists from different institutions and states to collaborate, review patient cases remotely, and provide a consensus treatment plan. And they do this via a secure web portal. Another tool is our ProScare Study app. The ProScare Study app is a web application which helps patients to report the presence of side effects during treatment in real time and receive prompt care within 24 hours of reporting. Oncopadi has built these purposeful tools and is improving how over 1,500 users from 8 countries experience cancer care. And we are empowering a new model of medicine that makes patients equal partners in their care. Now, more than 80% of our users are female, and 60% of them are caregivers. And these caregivers will receive personalized care online. They have a better perception of their journey, and this builds trust when they present to the clinic. In 2020, during the COVID-19 lockdown, cancer patients and caregivers were stranded, and Oncopadi was that purposeful tool that delivered more than 800 service points. 25 cancer specialists conducted over 500 plus teleconsultations, and 120 test orders were fulfilled via our e-health store. We're able to navigate 100 plus referrals to cancer facilities around the country. We consolidated our tele-oncology services in the area of cancer prevention, palliative care, and bereavement support. Now, Oncopadi could not have achieved all of this alone, and thus we are supported by global partners such as the Astella US Oncology, UICC, Aortic, the US Consulate, Tech Women, Yunus and Youth, Microsoft, MTN, Telecel Global, She Leads Africa, African Women in Technology, BVGH, Nigerian Cancer Society, and ACT Foundation. The company is founded and led by women, and we provide training and internship opportunity to a diverse group of people who want first-time exposure working in a digital health startup. Now imagine a world where you are not scarred by an inexperienced surgeon and left with a reoccurrence, where you are provided with the right healthcare support system to survive the toughest battle. Every Oncopadi app user has a friend and a loved one, and we are bridging the gap so that every day counts for people affected and impacted by cancer.